6:35 in downtown. A new law in the state of Ohio requires schools to teach children about the dangers of prescription painkillers, which are a leading gateway drug to things like heroin abuse. Now, this is state law now in Ohio.
Nationally, 1 in 5 high school students uses painkillers without a script, okay? Half of young people get hooked on heroin, became addicted to prescription painkillers first. They either got it on the street, got from their parents, got from friends, things like that. Joining us now is Kyle Simon, Director of Policy and Advocacy at the Center for Lawful Access and Abuse Deterrence. Kyle, is your opinion at first blush that this is something that should be mandatory in every school in this nation?
Well, we think it's a great idea, and thank you for having me, by the way. It is a good idea, and the reason why is the U.S. is in the midst of a prescription drug abuse epidemic with more than 22,000 Americans actually dying from prescription drug-related overdoses in 2013. But the way our organization looks at this is that educating about the safe use for prescription pain medications is important, but there's also a need to look at things like stimulants and benzodiazepines or anxiety medications, which are also subject to abuse.
This is part of the problem in my mind, Kyle, is that we're a very medicated society now. In primetime television, when family viewing time, every other commercial is take a pill for this, take a pill for that. So how do we get the message across to kids that there are times not to take the pill?
Well, it's important to basically educate people about the reality that these medications can be life-saving when they're appropriately prescribed and taken, but when they're not, they can be deadly. So there is a need for these pain medications for people who have chronic pain. There's also a need for these stimulants for people who have things like ADHD. But again, it's about safely taking these medications and adhering to dosages according to what your physician prescribes.
Kyle, let me ask you the basic question here. In your bio, it says you have several years of healthcare policy and political experience, that you've worked with the folks that make policy for Medicare, Medicaid, et cetera. Do these educational programs really have a significant enough impact to justify the cost?
I think so. The societal cost of prescription drug abuse is monumental. Like I said, 22,000 Americans in 2013 have died from prescription drug-related overdoses. That's not only a cost for people who go to the emergency room, especially people who don't necessarily overdose and die, but the cost to treat people who are abusing these medications, and also the cost of losing lives, is significant. So it's important that we save lives and make sure that people who need these medications have access to them.
In a perfect world for CLAD, where every student was getting this information, what would you recommend? Would it be ongoing, like a class, or would it be a limited time thing, a seminar that children would take?
We haven't actually looked at that yet. This is a very new idea that Ohio is implementing, and it's important. They actually have the state has the 12th highest drug overdose death rate in the United States. So it is important because a quarter of teens actually believe that prescription drugs are safer than street drugs. That's not always the case if they're not taking them the way they need to be. So it's something that we would like to see across the country. That the nation needs to follow the lead and end this epidemic.
Something new in the state of Ohio, and I'm sure there are other states that are studying it as we speak. Risk of painkiller abuse is now a required subject in schools in the state of Ohio. We're going to check and see whether anybody's considering that in Louisiana. But we've been speaking with Kyle Simon, Director of Policy and Advocacy at the Center for Lawful Access and Abuse Deterrence. Thanks so much, Kyle, for being with us this morning.
Thanks for having me.
Yeah, very enlightening discussion.